Hello, today we're going to talk about fracture prevention with Zoledronate in older women with osteopenia. My name is Daniel Rodriguez Guevara. I'm fourth semester parallel. The definition, introduction. The Zoledronate, also known as zoledronic acid, has characteristics that make it attractive for use in women who have osteopenia. It is administered by intravenous injection at intervals of 1 year or longer. It is preferred over oral biphosphonates by a majority of patients, and it has had a satisfactory safety profile. The current trial assesses the effects of Zoledronate on fracture in postmenopausal women with hip bone mineral density that is characterized as osteopenia.
In postmenopausal women with osteoporosis, bisphosphonates are first-line treatment for the prevention of fractures. Fractures can also occur in women with osteopenia, defined as a T-score between -1.0 and -2.5. Evidence for treatment in these women is lacking. Zoledronate, also known as zoledronic acid, is an intravenous bisphosphonate that is administered at intervals of 1 year or longer. In this randomized double-blind placebo-controlled trial, postmenopausal women 65 years of age or older with osteopenia were assigned to Zoledronate or placebo. The primary endpoint was the time to first occurrence of a fragility fracture, defined as any non-vertebral fracture, and vertebral fractures as confirmed by radiographic evidence. 2,000 women with osteopenia were randomized to receive 4 infusions of either Zoledronate at a dose of 5 milligrams or normal saline at 18-month intervals. After 6 years of follow-up, vertebral or non-vertebral fragility fractures had occurred in 122 women in the Zoledronate group, as compared with 190 women in the placebo group, for a hazard ratio of 0.63. Women receiving Zoledronate also had a lower risk of non-vertebral fragility fractures, with a hazard ratio of 0.66. 1,017 serious adverse events were seen in the placebo group, as compared with 820 in the Zoledronate group. There were no cases of atypical femoral fractures or osteonecrosis of the jaw in either group. The authors conclude that in postmenopausal women with osteopenia, the risk of fragility fracture was lower with Zoledronate than with placebo. Full trial results are available at nejm.org.
Now applications in medicine. Fragility fractures were defined as any non-vertebral fractures, excluding fractures of the toes, metatarsal bones, fingers, metacarpal bones, skull, facial bones, and mandible. And vertebral fractures are confirmed by radiographic evidence. The severity of the trauma that led to the fracture was not part of the definition of a fragility fracture. Secondary endpoints were the occurrence of symptomatic clinical fracture, the occurrence of vertebral fractures, change in height, and mortality, both the time to the first occurrence of fracture and the incidence of fracture were assessed for all endpoints with the exception of vertebral fracture.
Charlene Greenfield is in great shape. Good thing, because she's fighting a battle against osteoporosis.
When I got my first bone density test, I was shocked because I'm very healthy.
Osteoporosis is most common in women over the age of 50. It's a condition where the body loses calcium and vitamin D, which drastically affects bone health.
What happens is as the calcium leaches out of the bones become fragile, brittle, and are at greater risk to break.
In early stages, doctors recommend calcium supplements, but as the condition worsens, treatment moves to drug therapies, ranging from once-a-day pills to once-a-year IV transfusions.
And they all work very well in helping to reduce the number of fractures in women going forward, but they also have side effects.
Chief among them, upset stomach. It caused Charlene to throw in the towel.
So I quit doing that. So I went to just taking my calcium and vitamin D supplements, and have been doing that, but my scores are continuing to go down.
So her doctor recommended a new drug.
The new medication that came out is called Prolia, which is a biologic drug, meaning it's really like an antibody that affects those cells that remove calcium from the bones.
It's a twice-a-year injection that promises the same result without disrupting the stomach.
And the biggest side effect was GI intolerance to the pill medication, and that's pretty much eliminated.
With 2 shots in 1 year under her belt, Charlene hopes she's winning her bone battle.
I'm due to have my next bone density scan in 4 months.
For Lee Memorial Health System, I'm Amy Osher.
Now pros and cons. The current trial showed that administration of Zoledronate every 18 months for 6 years reduced the risk of fragility fractures, both vertebral and non-vertebral, in older women with hip bone mineral density indicating osteopenia. The odds ratio for death was 95% with Zoledronate, and the odds ratio for cancer was 95%. Among the 68 deaths that occurred between randomization and year 6 of the trial, 41 were from neoplasms, 25 in the placebo group and 16 in the Zoledronate group, and 8 were from strokes and 7 were from cardiac events.
This Medical Minute is brought to you by Avera.
As we get older, it's no surprise that our bodies start getting weaker. But are we doing enough to slow down that process?
Osteoporosis doesn't have to be a part of your future. In tonight's Avera Medical Minute, Jake Iverson explains how early detection can lead to some real prevention.
People should be smart about their health.
Connie Schiller is a strong, athletic woman, but as she's aged, her body hasn't fully kept up with her spirit.
I was going for my regular checkup, and she said, "You're at the age now, we should try a bone scan." The bone scan showed that it was less than normal, and so it diagnosed me with osteopenia.
Osteopenia is the precursor to osteoporosis. With both conditions, the body is leaching calcium out of the bones, leaving them brittle and weak.
For women, we reach our peak bone mineral density at age 30. And at that point, then based on genetics, based on calcium intake, exercise, any other underlying medical conditions, the process starts.
Connie was lucky she was diagnosed before she suffered a severe broken bone. A woman's first bone density scan should be done after menopause, when the body stops producing its natural hormones. Like most debilitating conditions, the sooner they're caught, the better.
It's important that earlier on, women have bone mineral density scans done so that we can try and pick up the process ongoing and catch it more in the osteopenia stages so that we can treat with medication, work with calcium, work with exercise so that they don't advance to the point of osteoporosis.
To check a patient's bone mineral density or thickness of the bones, doctors use a DEXA scan. It's a machine that is much more inviting than a CAT scan or traditional X-ray.
This was not bad at all. I mean, it's not scary at all. You lie on your back and it's over in a few minutes.
The scan is done on critical bone areas like the hip, spine, and forearms. With the results of the scan, a plan can be made to prevent the osteopenia from becoming osteoporosis.
So that's where it's very important to continually make sure you're getting your calcium and vitamin D intake to help to try and prevent the process.
With a healthy diet and a calcium supplement, Connie has seen her bones become stronger since her first DEXA scan. Even with this condition, she's not letting it keep her from living and loving life.
No, I'm making my life doesn't change, and I'm going to be as active at 80 as I am now.
If you're a Avera Medical Minute, I'm Jake Iverson, KSFY News.
This Thursday at the for more information or to register.
Issue updating Ecuador. In Ecuador, bone density and fragility pathologies are common among older citizens, being the most frequent in elderly women between 50 to 60 years old. One cause of it is the end of his ovulation cycle and menstruation, so it's an important task to keep analyzing treatment options for these patients. Conclusion. The current trial showed that treatment with Zoledronate every 18 months with minimal use of collagen supplements reduced the risk of fragility fractures, vertebral and non-vertebral, over the course of 6 years in older women with hip bone mineral density characterized as osteopenia. Thanks.